Acentra Health is the beneficiary and family-centered care quality improvement organization, also referred to as the BFCC-QIO for 29 states. One of the responsibilities of the Medicare BFCC-QIO is to perform hospital discharge and skilled service termination appeals for Medicare beneficiaries who feel their care is ending too soon. Appeals affect a variety of Medicare providers, including hospitals, acute rehabilitation facilities, long-term acute care hospitals, critical access hospitals, skilled nursing facilities, home health agencies, hospices, and outpatient rehabilitation facilities. The appeals process can be confusing to healthcare providers, and Acentra Health hopes to provide information to its healthcare partners in order to reduce any confusion. Acentra Health has identified that there are educational opportunities for providers based on tracking and trending of appeal data. Data analysts have noted several states with a high volume of appeal review denials. An appeal review denial means that Acentra Health did not agree with the intent of the notice, and the submitted documentation did not support the decision to discharge the Medicare beneficiary or discontinue his or her skilled services. This video will provide you with tips about documentation requirements to help ensure that medical records are complete and contain the appropriate level of documentation to help ensure the appropriate appeal outcome. The medical record submitted to Acentra Health needs to contain the specific components requested. It should be detailed and provide a clinical picture of the beneficiary and his or her healthcare needs and progress, and it should be consistent among the various healthcare disciplines, such as the attending physician, nursing, and physical, occupational, and speech therapies. An example of inconsistent documentation would be if a physician documents within the medical record that the patient is walking 150 feet with minimal help. There should not be physical therapy notes in that same record stating that the patient is walking 25 feet with maximum support. Other common documentation problems in the medical records that cause the physician reviewer to find in favor of the patient include insufficient documentation of therapy and other skilled services, which would include lack of physical therapy, occupational therapy, or speech therapy evaluation and subsequent progress notes. A lack of social services or case management notes, including the discharge summary, orders, follow-up consultations, and follow-up care. If there is unclear or no documentation of follow-up with the family or caregiver about the patient education for care, such as, has the patient family been taught how to provide care for his or her specific health need? Is that education documented within the submitted medical record? If there are significant medication or lab changes with no follow-up documentation, some examples include, is there documentation that an abnormal lab value was called to the physician? If a beneficiary recently started on insulin, is there documentation of blood glucose monitoring? If yes, were there any abnormal values? If yes to that, were these addressed? As part of Acentra Health's internal quality program, medical directors oversee the physician reviewer's case review decisions to ensure their best clinical judgment is used in rendering a decision, and where it is appropriate, coverage guidelines from the Centers for Medicare and Medicaid Services are followed. For more information about the volume of reviews and the rate in which a Medicare provider's appeals are overturned, Acentra Health's annual reports are available at www.acentraQIO.com/about us. If you have questions about Acentra Health or any of the content in this video, you can find our contact information at our website, www.acentraQIO.com.